need to be equipped, not at CDC and New York and California, but the whole country, right? We need to basically get more people into public health and get programs there. We need that rapid response fund at an area that we can really robustly respond and not try to make priority choices how we're going to use the money that we do have. And finally, we need to build a robust global health security network throughout the world. I've got a plan to do 8 to 12 regional centers that have full capacity so that we can detect, respond, and prevent infections at their source rather than have to deal with them at home. That to me is the most important, because if we have that, all the health departments are going to go up. But all the health departments and all of your own jurisdictions, I guarantee you, if you go talk to them, they're underfunded.
You know, just to follow up to what you've just said, by the end of 2020, it is estimated that the percentage of health agency employees eligible for retirement will reach 25%. So what level of investment do we need to train and hire the next generation of public health professionals?
That is one of the critical core capabilities, and I would like to get back to you with more specifics in that exact arena. We were challenged to come up with a very specific budgetary requirements to do with this, but it is critical. We have one program that I just mentioned briefly that my predecessor, Tom Friedman, started, which I think is really an important program. He took young people out of college and gave them 2 years, it's called the Public Health Associates Program, and then put them into health departments all across the country that wanted them. So now you get young, energetic people at the beginning of their career, not quite sure what they want to do, and they see the gift, what it is to do public health. You know, it doesn't necessarily come out that way probably when you read a career magazine, but they get out there and they practice public health, and a number of them then say, you know, I want to go on to medical school or public health school, and a number of them are actually working at CDC today. So expanding those programs to get young people to see the value of a career in public health, I think is critically important. And then obviously to be able to continue to retain the individuals that we have. But I think Tom Friedman's Public Health Associate Program is a really important thing for our nation.
Congressman Harris.
Thank you very much, Madam Chair. And thanks for taking time to appear here, because you're probably like a one-armed paper hanger right now, running around doing things. Let me just ask, let me follow up just on that global health security network issue. You know, we could have all the global health security we want, but when China denies the presence of the disease for what, a month and a half, what effect does that have? I mean, how, you know, the bottom line is that we know that the fatality rate in China is probably higher than it's going to ever be here in the United States. What protections do we have against a bad actor like that?
You know, Congressman Harris, I just think if we have these regional presence of strong teams, it's going to give us more eyes on the ground of what's actually going on. Nothing's going to be perfect. You know, this particular outbreak started in a certain area of China. I know I have had direct contact on either New Year's Eve or the day after with my counterpart, head of Chinese CDC. I don't think he was in the light that he had a problem in early December. So I can't really comment of how the local health department in Wuhan and how that was shared. I know that as soon as he knew, I knew.
Well, I'll just stop you there. You know, they arrested the physicians who, literally arrested the physicians who tried to talk about this new disease and how bad it was. So, you know, again, we just need to be protective here, but if we think we're ever going to get into that kind of closed system and somehow affect it, no, the communist Chinese are going to continue that system, and we're just going to have to live with it. Now, what's interesting though is one of the things that I hope you do is you're advocates for the kind of innovation that we're going to need to deal with these kind of new viruses, both on the vaccine front and the antiviral front. And I know your background is in virology. This idea that we produced an mRNA-based vaccine and got it to, delivery to the NIH in 6 weeks from conception is phenomenal, but it's an American company that has not had a profit for 10 years developing this platform. And if this vaccine works, we will owe it to American innovation. And yet, bills like H.R. 3, I think, will destroy American innovation. So I'm going to ask you, how important is the private sector innovative process, both for this and for antivirals and for treatment, when it comes to these kind of public health threats?
Yeah, thank you, Congressman. It's obviously fundamental and critical, and I'm going to give you the biggest example for me where it's antibiotic resistance. We have a program right now, and you know this, you're a physician, that really looks at surveillance and containment. But we're never going to win that. It's a containment strategy. The only way we're going to win it is new innovation. So innovation is fundamental for us to stay ahead of antimicrobial resistance, for us to be able to rapidly respond, what NIH and Tony Fauci's group's able to do now in 6 weeks, which normally would have taken them 12 months or more. So innovation has to drive. And if we lose innovation, we're going to lose our ability to maintain the advances we have in clinical medicine for antibiotic resistance. They're going to go aside.
Sure, and we made that point when H.R. 3 was being considered, that, and even the CBO agreed that there were probably a dozen diseases that we would not be able to develop treatments for if, in fact, we punish innovators in this country. And let me talk about one last and bring it around back to the testing issue, because one thing you said, and I'm curious about this, just from a public health perspective, is that Quest and LabCorp now are geared up to do this. Could they have geared up sooner? I mean, because you imply that we have to have a parallel track. We have to have this one system that is for public health bodies, and then this other system for the private sector, which it sounds like was ready to go, and probably because there is a profit motive, they're ready to go much quicker. Is that a model we should be looking at in the future? In fact, to do public-private partnership with some of these companies that have the ability for rapidly gearing up and then make these available to the public health sector?
My point that I wanted to make clear first is what CDC's responsibility was, the public health side. That said, as a clinician like yourself, I guess I anticipated that the private sector would have engaged and helped develop it for the clinical side. CDC has tried to help because the test that we did develop, IDT, asked the FDA if they could now actually commercialize it. And we said, it's fine by us, they can do our EOA. But I think those decisions on the commercialized section, I mean, we do have groups that can fill gaps. BARDA, for example, if they see a gap, they can begin to try to promote that. But I think, I can tell you, having lived through the last 8 weeks, I would have loved the private sector to be fully engaged 8 weeks ago.
Yeah, I think we have the wrong agency, I guess, to ask that question here. Thank you, Madam Chair.
Congresswoman Lee.
Thank you very much. Good morning. Thank all of you for being here. Thank you, Dr. Redfield, for being here and for really your tremendous leadership, and all of you. These are very challenging times, but you all have stepped up in so many ways. Let me ask you, first of all, with regard to hand sanitizers. And I'm not sure, and I'm trying to unpack how we move forward on this, but I know that, and we all know that one of the prevention strategies is to wash hands 20 seconds, and if in fact we don't get to wash our hands, we use hand sanitizers, right? That's part of the directive. Now, unfortunately, you can't find hand sanitizers. This small one I have, fortunately, I had another one at home, so I just fill it every day. Now, and I've been in 3 cities in the last 10 days. Nowhere can I find hand sanitizer. So what in the world is going on, and how do we make sure that hand sanitizers are available? I mean, unhoused people need them. There may or may not be water around, and so people who just don't have a lot of money, vulnerable populations, if they were around, they probably couldn't even buy hand sanitizers. And in fact, our healthcare workers and medical professionals on the front line. So what in the world is going on? And how do we wrap our hands around this so that we can make sure that the directions we receive from our federal government can be adhered to?
Thank you, Congresswoman Lee. Obviously important, and we've seen the shelves. This isn't an area that we drive, but I can tell you the interagency working group is looking at a variety of different things to figure out where there's shortages and what they can be done, whether it's respiratory mask or medicine or hand sanitizers, and I can get back to you exactly. But I do, from the public health point of view, at least remind people that 20 seconds of vigorous washing with warm water, hot water, and soap is going to work. There are people looking to track where is the supply issue here, and I can get back to you to make sure.
Yeah, could you please? Because a lot of people don't have access to warm water and soap.
Yeah, I understand that.
And need,
I know.
and we need to know that.
I will,
So-
I'll get the information from the interagency group and make sure it gets back to you.
Okay, thank you very much. And the second question I have is on the Grand Princess. First, thank you for your assistance with regard to this very challenging public health emergency and operation that's taking place in my district. I know CDC and HHS, I think HHS has been in the lead with our governor's office. Could you clarify what role CDC has in this entire operation, and what do you think in terms of time frame, how long it's going to last, and what have you learned in the last 24 hours since people have been disembarked?
So the operational lead, the mission leader is Asper. It's actually Assistant Secretary Robert Cadleck. He's in charge of the response. We provide technical assistance and support under his direction to the response. We obviously also are going to provide some technical assistance support as these individuals move to housing either at Travis or Lackland or in Georgia. But the operation is really under control. And probably most importantly, we make sure infection control issues are done right. And we do, we are the agency that gives the federal quarantine orders.
Okay, but are you the agency that monitors the whole public health criteria and protocols as it relates to the health and safety of the dock workers, the healthcare workers, the crew, the passengers, the community? Because where the ship is being docked is in an area in my district where historically we've had to deal with environmental racism and injustice, and so naturally we want to make sure this is not another one of those instances where we will, unfortunately, feel the impact.
We provide the technical assistance to the Assistant Secretary for Response and Preparedness. And our technical assistance is highly respected within the department, but they're ultimately in charge. But we're there to provide
Who
that.
signs off on the health and safety, public health and safety?
Ultimately, it would go back up to the Assistant Secretary's office.
The Assistant Secretary does. Okay. And then, okay, I'll ask my next question go around, Madam Chair. Thank you very much. I'll yield.
Congressman Pocan.
Yeah, thank you very much, Madam Chair, and thank you for being here. I got a lot of questions, so if we can be succinct, that'd be great. I did a Facebook Live town hall on Sunday, and we had several thousand views in the first hour and a lot of people asking questions. First of all, obvious, we're not cutting your budget. That's why we brought you here. I just wanted to say that. Now let's go to what everyone's asking about. Are we past containment? Is this strictly mitigation at this point? Just yes or no?
In different areas, we're in a containment in certain areas. I would say in general, we're in a containment blended mitigation. In some areas, we're in high mitigation.
Okay. When you say nursing homes, does that include assisted living and other senior living housing area? That's a question that people have asked.
Yes.
Okay, thank you.
Okay.
Succinct
Got it.
is great. Yes is a great answer. Want to ask, at the Friday press conference, the president interrupted you and said, anyone who wants to get tested can get tested. Is that true right now? Anyone who needs to get tested?
You can go to your doctor's office.
It's a yes or no, really, you don't have to give me a long answer. Just can anyone get tested right now, anywhere in the country?
Through a physician,
You can, yes.
through a physician.
But is that a yes through a physician?
It's a yes through a physician.
Thank you. Great. I wrote you a letter last week. You quit keeping track of how many people were tested on the CDC website. I think that's a bad idea from a number of conversations. What you don't know what you don't know, which is why we wanted to keep track of those tests. We had Secretary Azar, as of this morning, say he doesn't know how many people have been tested in this country. That was in an article at 10 to 10 on CNN. Why are we not keeping track of that, and why are we only updating the CDC website now 3 days a week? World Health Organization does it daily, and this is information people really want to know.
Yeah, we're doing it every day now, and we're actually got a new reporting system that includes CDC, public health labs. We're going to get direct dumps from LabCorp and Quest, so people are going to see all the tests done, where they're done, and we'll have a surveillance system that does that.
So the answer from yesterday, about 3 days a week, is already old news?
It's old
Now
news,
gonna be
sir. It's
daily?
every day.
Thank you very much for that. Appreciate that. Ron Kling and others have said we should be proactively testing. Dr. Fauci agreed. Anyone in a hospital with a pneumonia-like symptoms, as well as healthcare personnel. Are we now proactively testing folks like that and have a policy of proactive testing?
We are recommending to physicians that anyone that has a variety of clinical scenarios to be tested.
So how aggressively, though? Are we?
We're aggressive
proactively
now.
testing?
I mean, I
So
think
but we are proactively testing?
we're proactively in individuals with pneumonia or respiratory illness. It does vary by community. Where we have significant community spread, it's
But the recommendation is proactively testing
Proactive.
health professionals as well?
no, not necessarily all healthcare professionals. If they've had an exposure in a hospital where we've known cases, yes.
Okay, and how about police officers?
Again, we're seeing, as we've seen in Washington, that's one of the things in my trip that really surprised me, how many firefighters were no longer available because they were in 14-day quarantine. So again, it goes with exposure. We have increased awareness of how to approach a patient so you don't get exposed.
Gotcha. Okay. How about a question on the tests, going back? Other countries use the World Health Organization test. Why did we not use that test, and who made that decision?
Again, as I tried to say, our test was probably created as fast as anybody's test in the world.
No, I got that.
Okay. The WHO doesn't actually make a test. They have one of the German universities had made a test. So again, and that test would have then had to come here and go through regulatory review. I think our test was much quicker than they would. I would defer that question, though, to the FDA, and I'm
Okay, I
happy to
have
get the
them
answer.
in committee tomorrow. I will ask them that. Thank you very much. Another question, there was a article over the weekend, I'm going to pull it up, I don't mean to be rude if I'm not looking at you, saying that CDC recommended seniors not travel, and then it wasn't part of the White House task force recommendations. Vice President Pence said it was never a recommendation to the task force, and the story was completely fiction. Did the CDC recommend that older Americans not travel?
CDC now recommend.
Did they recommend at this point?
At
is
this
the
point
question.
that.
Not at this point, at that point, did you recommend to the task force?
I don't know exactly when that was.
Over the weekend, when there was a report that did not say it, and they're saying that CDC recommended it. At what point did CDC recommend seniors not travel?
Probably in the last 72 hours that we recommended. I can get back to you with the exact date and
Okay.
time. But we do reckon now that
I
not
don't
only.
want to have to do a Freedom of Information Act request.
No, you won't have to.
But I would
I'll
really
give
love
you-
to know when it was recommended by CDC, because there's a real distrust out there right now, and they don't know who to distrust because we're not getting information. And this is one where, right now, I'm trying to convince my in-laws not to travel to Las Vegas tonight. They're both in their 70s, and one has health issues. These are the questions we're getting asked in Facebook Live town halls. So when someone says it wasn't a request, and now I see you are recommending it, I would like to know when it was requested, and if I need to make
You don't need a
formal
freedom amendment. We'll
request.
get the information back to you, sir.
All right, thank you very much. And is that my time? Oh, I'm sorry, it went that quick. I
okay.
apologize. Thank you very much.
Congresswoman Frankel.
First of all, thank you for your work. I agree with my colleagues about we should not cut your budget. First of all, I wanted to say, and I'm sure you would agree with this, you said that this virus is expansive in Italy and South Korea, now in this country. It is absolutely wrong and inappropriate to call this the Chinese coronavirus. I assume you would agree with that.
Yes, China was the first phase. Korea and Iran was the second phase, with Italy, now all of Europe. I mean, just if you looked at even just last night, I think if you have a second, just over the last 24 hours, there was almost 1,500 new cases in Italy,
right. Let me just-
1,300 in Germany.
Okay, but thank you, you answered the question, thank you. There's been some other real misleading statements that are wrong. I'm going to read some. If you agree with these statements, just let me know. Our tests have been perfect, that this is like the coronavirus, like the regular flu, that it's a hoax, that anyone who wants to be tested can be tested, that the number of cases will be soon be down to 0, they'll magically disappear, you can still go to work, and it's okay to shake hands. This would be misleading. Since I'm not hearing anyone want to correct that, I'm assuming that you would agree that those are misleading statements.
I heard any that I would say is not, other than that I do believe that availability of testing in the last 2 days through Quest and LabCorp is finally getting us where we need to
Okay.
be.
Thank you. You know, there was a new, I just want to ask you, are you familiar with the public charge rule, the new public charge rule?
Yes, I
I
am.
think I'm concerned that it might lead people not to go to get the care they need. Could you respond to that?
I would concur with you. I've talked to some of your colleagues when we were on the trip in the state of Washington. They brought this, and we are looking at it to see its public health implications.
Okay, thank you very much. So would you say we were at the beginning, the middle, or the end of this coronavirus fight in the United States?
I would say I can't predict.
Okay. Can you say what percentage of Americans you think you are predicting will get the coronavirus?
I think it depends how effective our public health response is right now. I do want to state one thing. We all have a role to play. And it's really serious when we say to practice, the washing of the hands, coughing in your elbow, try not to touch your face. I know they're going to count how many times I did on this, but it's very hard, but you got to try not to. And then I think, if you're sick, stay home. Please stay home.
All right. Okay, well, did any health agency recommend to the White House that people over 60 should not fly on planes?
I don't know the exact age, I'll get back to you, but we have recommended that the elderly and vulnerable, including children with chemotherapy and others, should really reconsider at this point travel.
And what is the age of elderly, as many
Yeah,
of us leave the room?
I didn't define it, but I will tell you that in the discussions we had, the individual brought it up, did say it was a year older than they were.
What is that age?
Right now, we've been looking at the data we've been looking at, really, if you look at the data, the average age in Italy of death is like 82, 83, 84 years of age. It's really the data that Ambassador Birx has gotten from China, Italy, Korea, and our own nation. Looks like 65 and above is where most of the people are that are dying.
All right. One of the concerns I know we have is, especially in these nursing homes where everybody's getting sick, including the care providers, what is the level of your concern about us having enough care providers to take care of people as this disease spreads?
Yeah, this is the important of what we've talked about before, being over-prepared. If you're over-prepared, the ability to protect the healthcare professionals, and not just the healthcare professionals. I think the Congresswoman knows that in Washington, one of the places, they don't have firefighters. Their firefighters are all in quarantine, self-isolation. So we have to be over-prepared to respond to these outbreaks, not try to catch up. Time matters in infectious disease. We have more time in environmental disasters like hurricanes and flooding, than we do when it comes to an infectious disease. Infectious disease, if you're a week late, as some of you have criticized about the testing, or whatever, it matters.
So let me, I'm running out of time. We have another round coming? Okay, one more question on this round. So I have some friends or people who are self-quarantining themselves. We've read about it in the paper and so forth. So you get exposed, you self-quarantine for 14 days, is that right? Is that because you can have is that how long you have the disease for, 14 days?
Yeah, right now, the average incubation period from infection to symptoms is 5.2 days.
Okay, but how long does the disease last once you get it?
Well, it varies if you do get it, but if you get exposed, you will develop symptoms within those 14 days and be able to then either be diagnosed. If you stay asymptomatic, we have no evidence that you still shed virus longer than that.
But if you self-quarantine for 14 days, you come to work, and then you meet somebody who else, and you get exposed again, then you might have to self-quarantine yourself again, which means that we may all be in a process of self-quarantining.
You sound like what my wife said this morning, okay? We fully intend, I do believe, if we're all in this together, from individual citizens all the way up, we have a great public health department. We still want to stay with our early diagnosis, public health isolation, and then aggressive use of mitigation strategies. You know, we're in a fight to contain, to basically stop this outbreak, at least for now. Many of us are hoping, not knowing, hoping that this will follow the pattern of flu and other respiratory viruses. That means the transmissibility in our environment might change. It is interesting that when I look at the cases around the world and I censor out all the export cases and I censor out all of the contacts of exports, and you look in the Southern Hemisphere, there's very few cases in the Southern Hemisphere right now. It's a great possibility that might change, just like as flu changes. So I think we need to stay the course, be aggressive. This is again why I think being over-prepared is where the posture we want to be in. This is why the supplemental you did in such a fast way, in a bipartisan way, is so important to us, because it gave us resources now to scale up.
I think you're getting gavelled there. Dr. Redfield, thank you for your willingness to hop on the phone yesterday with me. I know the White House called you away, but I do appreciate your willingness to take a little time. So I'll start with some of the questions that I was going to ask you yesterday. Oh, no, it's obviously the White House was calling, so I got bumped. That's all right. Is this a pandemic?
You know, I think the word, I think, is really not important. Usually the WHO is the jurisdiction that makes that call. This is clearly a massive global outbreak.
Okay. So I know that Chairwoman Lowy started out focusing on where she's from, New York City. I'm from a very, very different part of the country, a very rural district that I represent in the northwestern corner of Illinois. In fact, 11 of the 14 counties in my district are almost entirely rural. So as you can imagine, my office is taking the necessary steps to prepare for cases, and we're doing what we can to make sure that we're filling in people with what we know. So we have been in communication with all of our hospitals, our community health centers, our county health departments, et cetera. So one of the concerns that has been shared with us through this outreach is how the virus could increase provider shortages, especially in rural areas. And so let me just give you an example to back up a little bit. One of the counties in my congressional district is called Henderson County. We have a patient-to-physician ratio of nearly 7,000 to 1. You know, if you want to compare that to Cook County, that's about 1,200 to 1. So you can imagine if rural doctors need to isolate themselves due to coronavirus exposure, there are limited options for our people. So I'm just wondering if you could offer, and anybody at your table there will maybe give folks, other folks an opportunity to answer this as well, but what steps can rural communities take to continue treatment if their providers get sick and cannot see patients? If you have any advice specific to more rural parts of our country.
Any of you want to make a comment? I'm happy to make a comment.
Please.
This is an issue. And this, again, is why we've heightened the area of infection control. Because as we've seen now in Washington, and we've seen now in California, we got 600 healthcare providers out of work in both of those environments, and that's causing strain. The source for most communities, if this is going to happen, is probably going to be a nursing home. Mm-hmm. And then that they go into the hospital, and then the hospital, you know, you don't have diagnosis. Someone gets sick from the nursing home because someone came in and visited who just came back from Italy. They visited their sick mother in the nursing home, and then they got sick and went in the hospital, and then boom. So I think we just have to be aggressive in the infection control and really work hard because, you know, this is what happened in Wuhan. That's why the mortality was so high. They had 130 infection beds when they started. They had over 20,000 within about 4 weeks. But you know what they didn't have? They didn't have doctors and nurses and equipment to staff those 20,000 beds. Their health system fell apart. And that's why the mortality was so high.
And are rural areas more at risk for something like this?
Well, you may have the benefit of being more isolated from a large population. So, you pray that you pray that the virus doesn't really get into a community transmission zone. If it does, it's going to come through a nursing home, I would bet.
Is there anything from anybody else at the table who would have anything to add to what Dr. Redfield just shared?
And thank you for the question. I mean, rural health has been an ongoing issue for a long time. And like with a lot of other things that we've been talking about here, the coronavirus and the COVID-19 issue is just sort of shining a light on a number of deficits that we've had in our healthcare system and in our public health system for a while. We have been involved and have some resources. They're very small in terms of how it is that rural communities generally, not in this situation specifically, can have resources that they normally wouldn't have that might be helpful, and we can follow up and send you some of that information and talk to your staff about what's available and what are the kinds of things that we have supported generally that may come to bear for COVID-19 as well.
We'd appreciate that. Anybody else have anything else to offer? Okay. Something else that we've heard from nearly everybody that we've contacted as far as health providers is the respirators, latex gloves, eye shields. They've all expressed a need for more of this equipment. And I don't think anybody's asked this yet, but kind of the plan to make sure that this protective gear is out there for our healthcare providers.
Thank you for the question. This really is the important role, and I'm sure you'll have a hearing there for ASPR to really look. They manage our stockpile. I will say that the interagency group has done critical analysis of, as I mentioned before, all the different things we need. Mask, protective gear. I know the vice president went out to 3M the other day to visit them with masks and try to see, they're making about 35 million masks a day, but unfortunately only 4 million of those are for medical use, and about 31 million are for industrial use. And you'll probably hear more about that because I think ASPR and others will be coming up with a plan to try to see how maybe some of that could be modulated. But it's an ASPR issue, and we can make sure they get in touch with you so they answer that question.
That'd be great. Thank you very much. I'll yield back. Thank you.
Congresswoman Watson-Coleman.
Thank you, Dr. Redfield. Thank you for the information you're sharing. And I associate myself with all of my colleagues who say we're not cutting your budget any way, shape, or form. I do have some questions, and do you have any idea how many people have been tested?
Yes, I have an idea. We're now just getting all the health departments to come out and begin to collect the data, and we are going to put it out every day, as I mentioned to Congressman Pocan.
Could you tell me how many?
Right now, I have, as of yesterday, 4,856 from public health labs only. So that doesn't include the clinical labs, that doesn't include the private labs. We're trying to get it all together so you'll have a single point in daily, and that surveillance should be out soon.
Do the individuals who get their tests at the private labs still have to have the diagnosis confirmed by the CDC?
If their lab is not independently approved by the FDA, we do still do a confirmation of those state labs. So the clinical labs have been reporting their test as is.
Okay. I have a New Jersey specific question. Unfortunately, we only have, I believe 10 is the number today, presumptive cases, but there are 6 people with presumptive positive cases that have yet to be tested by the CDC. So New Jersey, I guess, did its preliminary, whatever it is it does. And I understand that this is a rapidly evolving situation, but can you confirm with us why there has been a delay in the confirmation from the CDC on these 6 cases? Our staff have checked, and CDC staff confirmed that there's not currently any delay due to volume. On previous media calls, CDC's Dr. Maisonneuve, French. It takes about a day to ship tests to CDC, and then we have confirmation within 48 hours. And she also said the CDC does have a secondary test for quality control measures. Why is it now taking more than 1 week for verification?
Yeah.
Why do we have this delay as it relates to the 6 presumptive cases in New Jersey.
Yeah, I'll have to look into that, but I will tell you, if they've confirmed in New Jersey, and I have that there's 11 confirmed cases in New Jersey as of now, they're considered a case, all right? So, and then we follow up and confirm it. I
So
will,
do they know that?
yes.
Okay, because I got the impression that they're still waiting for confirmation, which suggests to me that they don't
Yeah,
necessarily know
because,
that.
yeah, we'll clarify it for sure, and we'll get back to you so you know exactly what the reality is.
Okay.
Thank you.
So I have a question about what happens if you are confirmed to have this virus and you are isolated, you're in a hospital, you're whatever, right? You're in a hospital. What is the treatment?
So it's very important for everyone to hear this very clearly. A majority of people who get infected with this virus, particularly those that are under the age of 60, are quite relatively healthy, and they would go to home isolation. We'd ask them to restrict their movement, stay at home for 14 days,
And do what?
and basically do everything they can to not infect anybody else that lives around them. And we have very
There's
good,
nothing that they can do.
there's nothing that they need to do other than what we used to say when I was a doctor, rest, drink a lot of fluids, take some orange juice.
And is that what
And please,
happens?
please, honor the home isolation. But I will tell you, for people that are very sick, and we have a number that are very sick, there is an experimental drug called remdesivir that's available right now in compassionate use. This country's used it. A number of people in the state of Washington have been treated with it. And there is clinical protocols going on by Tony Fauci and NIH comparing that to placebo, both here and overseas in Asia. We're going to know probably by April whether that drug works or not. And that's important because that's a drug that can save lives if it works.
Should we expect the CDC to not confirm state health lab results?
I think we're moving in that direction.
Well, why is that? Isn't that primarily what you all do in this situation?
What's going to happen is a number of these laboratories are going to come out with their own regulatory approval to do the test. Right now, they're all,
I'm sorry, are we going to be sure that all states have the same sort of standards that, we're apples to apples across this country, not apples to oranges and peaches and pears?
well, we put out our standards for the public health labs. Obviously, as you know, each state has their own, but we do put out our standards. Right now, all the state labs are working under our emergency operation, our emergency use authority. We are in the process of getting each state, each lab to get their own with the FDA, and that's ongoing.
Thank you. I yield back. Thank you, Madam Chair.
Congresswoman Clark.
Thank you, Madam Chair, and thank you all for being here today. As you know, we have been warned about moving from containment to mitigation. And I think the lack of testing that was done has hastened our move out of containment phase into mitigation. Would you say that's true across the country?
I would say, Congresswoman, that I think one of the biggest drivers of what we're going through right now is the movement of this outbreak risk from travel from China to travel from Europe. And individuals are coming back from Europe, and they're seeding communities. We will have to determine, and we will know quickly, how much is that driving it, or how much was there community transmission before that wasn't recognized because of less testing. We'll figure out that answer, because we're going back and looking at, let's say, blood samples that we can go back a month ago and do surveillance and see what was there through. But I will say, my own personal opinion right now, the new cases that we're seeing in the United States are probably disproportionately driven from people that have returned from Europe and then gotten into a community, and then we've seen secondary cases and tertiary cases. That's my own personal opinion, but I'm not going to die on my sword on it. I'm open to the data to show us that, no, that's not true. There was more transmission that we missed.
Well, we want to make sure that we remain data-driven, so I appreciate that. But I think that we can, as we look at what's happening, I think we are going to continue to see totals doubling and more of a move to broad scale, actions that we need to take to mitigate this, because our testing's behind where the virus and infection rates really are. How are you working with sort of the front lines on this, which is going to be our local public health officials, managed by the state, and hopefully supported by the federal government? How are you working with them to give opinions on large-scale gatherings? Should they be canceled? Is there a role for the CDC in that sort of work?
Thank you very much for that. We initially deployed teams into California and to Seattle to work over the last several weeks just on this issue. And I will tell you today, the Vice President's office will be releasing a mitigation strategy for all states and territories in this country, guidance that we've worked on for the last couple of weeks.
Can you give me any preview?
Well, what it is it's a framework for each of the states to look at a number of different areas, and they've put into low risk, moderate risk, and high risk, and different examples of what they need to do. I will be probably reaching out directly to Massachusetts in light of the recent cases that they've had. They now are basically one of the top 5. Last night, we had a long call with the health leaders of the top 4, and we've asked them now to take this template and edit it very carefully, which they're supposed to have completed by 12,
we're meeting with the top executives of the health insurance companies, the biggest companies in our country, probably the biggest companies in the world. I can't imagine being much bigger. But these are the great health insurance companies. And I think tremendous progress is being made. They're willing to do things for the people and their customers, and probably in a true sense beyond their customers, that normally I don't think they'd be doing. And so I want to thank them, and I'll ask Vice President Pence to maybe give us a little update as to where we are.
I'd be very happy to. Thank you, Mr. President. President Trump made it clear from the early days of the coronavirus in the United States that this would be a whole-of-government approach. We've brought the full resources of the federal government to bear. But this president has also called together businesses and industries to make this a whole of America approach. Last week at this table, the president met with pharmaceutical leaders. We met with nursing home leaders, the leaders of commercial labs, airline industries. We're bringing all of the businesses of the country to bear to protect the health of the American people. But today, Mr. President, you directed us to bring together insurance companies, health insurance companies that cover through private insurance and through their support of Medicare and Medicaid, almost 240 million Americans. And I'm pleased to report, as you requested, Mr. President, that all the insurance companies here, either today or before today, have agreed to waive all co-pays on coronavirus testing and extend coverage for coronavirus treatment in all of their benefit plans. And at your direction, Medicare and Medicaid last week already made it clear to Medicare and Medicaid beneficiaries that coronavirus testing and treatment would be covered. These private insurance carriers have extended that as well. They've also agreed to cover telemedicine so that anyone, particularly among a vulnerable senior population, would not feel it necessary to go to a hospital or go to their doctor. They'll know that telemedicine is covered. These CEOs have also agreed to no surprise billing. We want people to get tested. Over 1 million tests are out, thanks to the diligent work of CDC and HHS. More than 4 million will go out this week. You've worked with commercial labs to expand testing, and that'll continue to increase by the day. But we want the American people to know that they are covered through private insurance. They are covered through Medicare, Medicaid, and there'll be no surprise billing. And finally, Mr. President, as you directed us yesterday, we produced helpful information for every American family, how they can keep their home, their school, their business, their establishment safer from the spread of the coronavirus. All of these major health insurance companies have agreed to convey all this information starting today to all of their customers, as well as to send the CDC's guidance for seniors with underlying health conditions to give them specific recommendations. And so, as you requested us, they've all agreed to work with us to communicate information directly to the American people. Because as you said, Mr. President, while the risk to the average American of contracting the coronavirus remains low, we want a full partnership with industry and give the American people all the information they need to avoid contracting or spreading the coronavirus. And particularly, these companies are going to help us get information to seniors with underlying health conditions who really represent the most vulnerable population to serious outcomes. And I know I speak on behalf of the President when I say how grateful we are for the collaborative spirit, the generosity, and the partnership represented by the great companies at this table.
That's true, very true. And we are working very closely with the cruise line industry, and very, very closely. They're taking very strong steps in terms of people going on and going off. But they're spending a lot of money, and they are working very hard, and we're going to be helping that industry. Likewise with the airline industry, they're taking very, very strong steps for people coming into our country, even getting off the planes. So we are working very closely with them. We're helping them. They're two great industries, and we'll be helping them through this patch. And so far, I think it's been going very well. You know all about the big ship that came in yesterday, and that's going along incredibly well, working with the state of California successfully, very successfully, also with Canada and with UK. So UK is taking their people, their citizens back, and Canada is about 600 people. They're coming back, they're being met and brought to planes and being brought very, very, in a very, very dignified fashion back into Canada. So we appreciate all of the help we've had in that, and that's working out very well. With that, I might just ask a couple of folks if you'd like to make a statement on behalf of the industry. Perhaps, would you like to make a statement on behalf of the industry?
Sure. This is Gail Boudreau, and one of the things that I think is most important is from day one, as an industry and as a company at Anthem, we have been very focused on ensuring access to care, and that cost is not an issue for people to have the testing appropriately done. So we're pleased that we're able to continue to expand this access. And as the President said, I think it's really important for all of our customers, our members, and the American people to have this. So we are very supportive of the efforts underway.
Great job you're doing. Thank you very much. Anybody else? Would anybody else like to make a statement? Even the ones over here, you can turn and get ahead. Look at those cameras.
So I'll say on behalf of the industry, we represent the great companies around the table here, but then those that operate at a local level, that we all have the same commitment to making sure that cost is not a barrier to people getting tested and treated. We want to make sure that we're focused on prevention, testing, and treatment, and getting that information out as quickly as we can to make sure people know how to limit the spread of the disease.
Very good. Thank you very much. Please.
Mr. President, on behalf of the 36 independent Blue Cross Blue Shield plans that insure 1 in 3 Americans, we're pleased to make sure that people have access to the test, to the coverage that they need. I also want you to know that the commitments we've made also apply to the Federal Employees Program, where we insure over 5 million employees.
That's great. Thank you. Thank you all.
Maybe.
Please.
I would just like to say, as a large servicer of Medicare, that we are very oriented to the aging population, and most importantly, how do we make it as easy as possible for them to receive their test? And being able to do it in the home is a very important part of that. And so when we think about telemedicine at home, it reduces great barriers to allow them to have the testing.
And a lot of people now are taking advantage of that, really strong advantage. Who else would you suggest?
Maybe Dave Wickman.
Dave, please.
Mr. President, thank you for having us first and foremost. And I guess just to extend the conversation here, we're working very hard to protect the health workforce, which we think is essential to ensure that Americans have access to the proper care. Getting the health workforce back to work, so quickly tested and back serving patients is a high priority for us as an organization, serving somewhere around 18 million patients across America.
Right. Well, thank you. And Governor Pete Ricketts, Nebraska, everybody. Nice to see you, by the way.
Mr. President, I just appreciate your leadership and the Vice President's leadership to work with the governors to be able to make sure we're keeping people healthy in our states. It's been a fantastic cooperation at all levels of government. We really appreciate also all the cooperation of all these executives around the table to make sure that the people in my state and all the states across the country will be able to get the test and not worry about having it.
Right. Great thing. Thank you all very much. Thank you. Thank you very much, everybody.
Mr. President, your former Homeland Security.
Let's go!
We're about 10 days away from the hospitals getting.
Let's go!
We're moving.
Do you want us to leave the tripods?